and a gynecologist. Well, we are into a very lovely and a most happening topic for today: hospital checklist. What to pack for the labor preparations. But to begin with, we are going to talk about BabyChakra, which is the number one parenting platform, and also an platform for all the mothers, expecting parents, doctors, and researchers who come together to take these live sessions. Before we begin, I would like Dr. Swetha to introduce herself, please.
Hi, I'm Dr. Swetha Bobba. I'm from Prashant Hospital, Vijayawada, Andhra Pradesh. I'm an obstetrician and gynecologist.
Right. So Dr. Shweta would be answering our many questions, and you can also ask her the questions in the link which is given below. So to begin with, Dr. Shweta, well, when it comes to hospital bags, most of the moms are in a situation of not understanding what to pack and what to carry and what to keep at home, because at a given point of time the doctor tells them to get ready, or they are waiting for their little ones to come arrival, but it's really confusing. So can you just help us to understand what should a mother pack in her hospital bag?
Okay, well, it should, there are multiple things that a mother should pack. So she should start packing it earlier, especially when she's entering her third trimester. So, first of all, you should keep in mind documents. So, her past reports, scan reports, all of the ones from the first trimester, first visit onwards till the last visit, she should carry them, because many a times suddenly they have to go to the hospital and they forget the files. So that's very essential that the files have to be there, the blood investigations, scan reports, and if there's any health insurance of sort, that should be sorted out well ahead in time.
Right. So when you talk about the labor, when you talk about the back packaging, it should it be before the labor or during when the mother is somebody should get the bag into the hospital? Or like how it should be? Any should a mother depend on any family member to get the things in the hospital, or she should carry the bag when she is ready to move to the hospital for the delivery? How it should be?
So, as I said, when they around 34 weeks of pregnancy, from then on, if it's a non-high risk pregnancy, actually 37 weeks, that is term pregnancy. So, a mother can go into labor at any point of time. So, her bag should be kept ready. And at 34 weeks, if it's a high risk pregnancy, such as hypertension in pregnancy, or even if there's some growth restriction for the baby, they might be early delivery of the baby. So, then the bag should be kept ready. So what all should be included in a bag is, a small things from nursing bras to maternity gowns with front zips, so it's easy for feeding. All of these are very, very small things that should be kept in mind beforehand and packed beforehand. So immediately when she has to go to the hospital, she can just pick up her bag and go to the hospital. Small things like slippers, comfortable slippers when she's in labor. She can go walk around, for some time when during labor, during early phases of labor. Any toiletries, sanitary pads, all of that she should pack well ahead in time. Even for her baby, she can keep two bags, one for herself and one for the baby. So for the baby, they can keep body suits, diapers, wet wipes, swaddles, because babies like, swaddling. They're enclosed in a small environment inside the uterus, so they like swaddling. So all of these things are very essential. Even beanies to keep them cozy, mittens because they'll have sharp nails. All of these are very small items which are required. And so two bags are essential: one for the mother and one for the baby.
Well, that's a very interesting part that you have said, because most of us forget only for the part only for the mother, and it's generally a ritual which is generally followed that you're
Even
not supposed to
snacks.
take.
Yeah, even
Yeah.
snacks during labor, she might want some nuts or something to chew on, so, and a lot of fluids. She should like, maybe she can pack that ahead in time, like which in packets well ahead in time. So
Okay.
you don't have to carry that along.
Okay. So, you have put a very valid point that a separate bag for mother and separate bag for for the baby. But in most of the times in during the some some elderly people say that you should not pack for the baby. So is it true? Do you believe in this myth that you should not pack for the baby?
Honestly, it's more convenient. Like, there's no such thing as you shouldn't pack for the baby. Obviously, you cannot buy an entire wardrobe for the baby before they are born. So essential items like, as I told you, blankets or swaddles, as soon as the baby delivers, they need to be wrapped up in a clean cloth, and then they need to be wiped up. Then they need clothes and diapers. Like, all of this you cannot get it last minute as soon as they deliver. So they need to be, you can get certain things afterwards, but certain small things, as I mentioned, are very important for babies. Yeah.
Right. Thank you so much. We have a question from a mother who is asking us that is, are hospital clothes safe for after delivery for the mother and as well as the baby? What would you put your thoughts over here?
Hospitals, yeah, hospitals usually provide really sterile and clean gowns and cloths for the baby. But obviously, as soon as like the first day, you can, if you're going to bring your own, you can use your own clothes as well. So there is a, and you can even reuse your clothes after you leave the hospital, as long as it's washed and sterilized properly.
Okay. One of the moms is expecting a twins and she would like to know whether, she should carry two separate bags for her twins, or she can carry uh, all the essentials in one bag. How would you address this question?
So obviously, it's convenient to have one bag for both the babies, but sometimes in twins they are born prematurely. So one twin might be in the NICU, that is in the neonatal ICU, and in that case, it's better if there is a separate bag. So so whatever is convenient for you. If you're very particular, you want some things for one twin and there's some things for the other twin, then you can have separate bags. But one bag as well is good enough, as long as you should have double the items. So it's double planning in that way.
Yes, absolutely, absolutely. And when we are talking about the birth of a child, do we really put these things? Do we give these things in advance to the nurse so that when the baby is born, the baby is all dressed up the way we want it? Can we do this? Can we follow this in the hospital?
So
Like the
as soon
clothes or any clothes or any other outfits that we have the parents desire for.
Yeah. As soon as the baby is born, you can keep a as I said, a blanket or a swaddle ready, a cloth for the baby to be cleaned with, and you can tell the nurse, or if you have a dua, you can tell them beforehand that okay, these are the items, and yeah, so like that should be sorted. As the hospital usually can provide blankets, you can use them, and after that, you can use the items you bring.
Okay. Okay. Doctor, I would like to ask you a very important question. Like the baby is born and he or she is all welcomed. I mean, what is the most important thing that a mother should keep in the mind after the baby is born? Can you address this query, please?
So as soon as a baby is born, so initially the most important thing is breastfeeding. So breastfeeding has to be done within 1 hour of delivery. So that skin to skin contact is very essential for the mother and for the baby. And a mother should make sure that she's eating healthy, she's hydrating healthy. Obviously not in the 1 hour immediately after delivery, but that mother to baby touch is very essential. And after the baby is born, within the first 2 or 3 days, mother can experience something called baby blues. Like 70 to 80% of women experience that. That's because of the drop in hormones such as estrogen, progesterone. So they will have all of these mood swings, excessive crying, difficulty in bonding, and they might even doubt themselves whether they're taking care of their baby a lot. So you should never doubt yourself, especially during the first few days. Keep yourself around supporting people like your family, and keep in touch with your friends, and you're doing a good job. So you should never doubt yourself, because 80% of women have that and they don't know how to handle it.
Right. Thank you so much for enlightening us on these, important aspects when we are talking about a mother who is ready to deliver, and the part that she becomes a mother and the acceptance that the baby is come into this world. So would you like to give a takeaway message to our audience out of here?
Um, packing your bag by 34 weeks of your pregnancy is essential, no matter what, actually high risk or low risk. But if you have a normal pregnancy, then by 36 to 37 weeks is ideal. And make sure, like, oh, I had to add one more partner, like your mother or your husband. May ask them to pack their bag as well, because they will be taking you to the hospital and they will be staying with you. So you can ask them to get your bag as well. So the early postpartum period is a very crucial time for you and your baby. So just planning ahead can always be helpful. Yeah.
Right. Thank you, Dr. Shweta. So, coming to the end of the session, I would just like to sum it up saying that in the hospital checklist bag, do carry all the essentials which the doctor has mentioned: the diapers, the sanitary pads, the blankets, the warm clothes, slippers, and everything. These are all essential aspects that we need to understand that a mother and a child would require. And as doctor said, carry a separate bag for yourself and for your baby. And in case you have twins, you can have double the quantity, which will be very, very helpful for the mother and the person who is going to take care of your family in the time in the hospital. So with this, we come to the end of this session, and it is a very insightful and a meaningful session. But if you have forgotten to watch us live, you can go onto the BabyChakra app, download the app, and see this insightful journey about how to pack your hospital bags. Have a checklist, and don't forget to share it with your friends and family members. So, thank you, Dr. Shweta, for joining us live and answering our viewers' question. It was a pleasure having you here.
Thank you very much. It's an honor.
Yeah, thank you.